Good afternoon, and thank you for joining us on this lovely fall day for McKonly and Asbury's virtual summer series. We are certainly at the tail end of summer here. CEO Perspectives in Challenging Times. This is the third and final webinar in our series, and for those of you who followed along with us, we began with an update on housing with Dana Hanshin from HDC, and then we moved on to the basic need of food, where we had Joe Arthur from the Central Pennsylvania Food Bank. And now we're focusing on healthcare. So certainly a challenging area, and particularly in the last 18 months. And we're thrilled to have you with us today. And I'm very excited that we have Alisa Jones, and I can't wait to introduce you to her. And she is the president and CEO of Union Community Care. So thank you for being with us, Alisa. So,
my pleasure. Thank you.
So very briefly, I'm Janice Snyder, partner and director of audit and assurance services here with the firm. And I have with me today, Gary Dubas, one of my partners as well. And he is our director of nonprofit services. So thank you, Gary. And I'm going to turn it over to Gary to just tell you a little bit about the firm.
All right. Hey, thanks, Janice. And what a great afternoon. Just a precursor to Friday happy hour, we'll call this today, this afternoon here this Friday. So let me just give a quick firm overview here. This is McKonly Asbury, where offices are in Bloomsburg, Lancaster, Camp Hill. We're a business advisory consulting accounting firm that does many services to many industries, as you can see on the screen, from affordable housing, healthcare, nonprofits, family-owned, etc. So, and I want to say is we're open for business, as we say. You know, if you have a question, if you have a concern, if you have something you want to bounce something off if they haven't worked with us before, give us a shout through email, through a phone call, etc. So we are looking forward to working with you if we haven't worked with you before. Before I turn things over to Janice for introductions, a little more introductions here, I just want to say a couple of housekeeping matters here. This is meant to be an open dialogue. So in the chat function, you can ask questions and we'll try to get to them as we go. So there'll be some Q&A. As time permits, we'll field as many questions as may come up along the way. And if it goes longer than our time, a lot of time, we could possibly go offline with that as well. So just, again, along the way, if you have any questions, put those in the chat. And I will turn it back to Janice.
Great. Thanks so much, Gary. So I have the pleasure of introducing you this afternoon to Alisa Jones. Thank you for being here from Union Community Care. So she is the current Chief Executive Officer of this federally qualified health center. So she came from another federally qualified health center in Chester County and has a long history of working in public health. I also know during her time here, she merged two FQHCs in the middle of a global pandemic. One of the reasons I was very excited to talk to her this afternoon, and I hope you are as well. She certainly has a passion for serving the underserved in our communities, and I look forward to all the insights and all that she will share with us today. So I know, Alisa, I'm going to turn it over to you to tell us a little bit more about Union Community Care.
Thank you so much, Janice. I appreciate very much the opportunity to share with you all the work that we're doing at Union Community Care, and of course, to hear from you. Love to hear your questions, your comments that you have as we go along. So at Union Community Care, we really stand firm in our purpose, and we wanted to share a little video with you that gives you an overview about the work that we do in the community.
All right, here we go for the video.
At Union Community Care, our purpose is to spark equity through healthcare that heals, that welcomes, and that ensures that we're bringing together, that we're integrating mind, body, and heart.
Oftentimes, we're the first ones out when there's a need because we are in locations that are accessible to our patients.
At Union Community Care, we provide full spectrum primary care for patients. We serve mainly underserved patients in Lancaster and Lebanon counties.
We do it through a variety of different services, not just medical care and dental care and social services and behavioral health, but we do it in the way that we bring together those services.
We're not looking at healthcare from a one-side view, which is, I'm sick, I come to the doctor. We are looking at other ways that we can facilitate some of the other ills that our patients have.
Our job is to take the brick of you don't have money, take it off, put it aside. Take the brick of you don't have health insurance, take it off, put it aside. Take the brick of you don't have a positive history with healthcare, take that brick, put it aside through the way that we provide services and build trust. So that's how we're different, because we understand that you come in through our doors with all of your experience, and our job is to take those bricks and help remove them.
What really sets us apart is our ability to care for patients regardless of their ability to pay. So being able to care for patients who are uninsured or underinsured, having a sliding fee that makes healthcare accessible to them.
Our patients have the ability to have wraparound services to address social determinants of health at every site that we have. That is part of our workflow. So our social workers and community health workers and behavioral health clinicians are embedded in our medical practices and our dental practice.
The fact that we can provide so many other services makes it a complete health home for our patients, not just a dental home, but a medical home.
The best thing that we do is to understand the communities that we serve.
Many of our providers speak multiple languages and have worked with patients from different cultures and different languages for their entirety of their careers. Our providers and our staff work here because they love the work that they do, and they find fulfillment and satisfaction in caring for every patient that walks through that door. We're just uniquely positioned to be able to care for people from all over the world and anybody from our community.
We are out in the community working with our partners, making sure that we are meeting the needs of our community, addressing social determinants of health.
Me gusta, pienso de que los médicos que atienden aquí y las enfermeras son excelentes en cada uno en el rol que le corresponde. Me gusta porque nos cuidan con respecto a lo que venimos, están preocupados, nos siguen, nos continúan chequeando cómo vamos el progreso de cualquier cosa que se nos presenta, alguna enfermedad o alguna dolencia. Nos llaman para preguntar cómo estamos, que si estamos bien.
Our vision at Union Community Care is that when we do our job to the best of our ability, we are going to have a healthy and thriving and vibrant community in Lancaster County and Lebanon County, where folks have access to the care that they need to get, and most importantly, to stay healthy.
Alisa, that was wonderful. I'm very excited to hear more about how you spark equity, build trust, remove bricks, and create a healthy and vibrant community. So that was wonderful. So
Thank
go ahead,
you.
Alisa, tell us about your purpose.
Absolutely. So as you heard in the video, our purpose is to spark equity through patient-led healthcare that welcomes and strengthens our communities by integrating body, mind, and heart. So in the next slide, we tell you a little bit about our vision. So when you think about a vision, it's really done in collaboration with others. So our vision is that vibrant and healthy communities, once they're supported by inclusive healthcare that embraces unique culture, needs, and values, emboldens members of the community to make healthful choices that fuel their well-being and the well-being of others. So we see what we do, both our purpose and our vision, as much broader than simply providing healthcare or dental services. We're actually in the business of making community stronger, and we do that with our partners. In the next slide, our model of care is exactly that. It's whole health, right? So to make community stronger, we have to take that whole health approach that looks at not just the individual's disease condition, but also what are the social factors that might be driving and influencing the health status of community. And those we consider them to be social ills. And we know that we have to be working at that level in order to achieve true equity, which is our purpose. So you got a preview of the next slide, which describes the fact that we are a patient-centered medical home. And what that means is we have national recognition. So we have national recognition for the way that we provide services. And we, every year, submit documentation and proof of the quality of services we provide in order to maintain that recognition through the National Council of Quality Assurance. Next slide. One of the unique factors in being a federally qualified health center is that over half of the individuals on our board of directors are patients of our health center. And that is very unique in the nonprofit environment. So we are led by individuals who are using our resources, who are calling on the phone, seeing our clinicians, coming into our sites. And that, in my opinion, adds a tremendous amount of richness to the feedback and the guidance that they give. And I'm very proud to say that a couple of our board members are joining us today for this conversation. So welcome.
It's great, Alisa. And I'm sure those board members don't hesitate to give you their feedback when they come to those meetings and let you know how you're doing.
Absolutely. Absolutely. So next slide. So we do provide services across 10 sites in Lancaster and Lebanon. One of the things that really does make us unique is that we offer all of our services on a sliding fee discount program, which means that the cost that individuals pay is based on their income and their family size. And in many cases, folks who are living in poverty pay $15 for a visit with a doctor or a visit with a dentist. And we all know that the cost of medical care is much more than $15. So we work creatively to be able to close that gap between the charge for the patient and, of course, the cost of care. And if our patients can pay nothing, then they pay nothing. Cost and ability to pay is never a barrier to receiving services at Union Community Care.
That is such a wonderful thing, and certainly I'm sure creates financial challenges, but we'll talk about that later.
Absolutely. So next slide, I just wanted to make sure you all had a chance to see where our locations are. If we can serve you or if we can serve a member of the community, please don't hesitate to reach out to us. We are here in Lancaster and Lebanon counties. So our patient population is very diverse. We serve about 34,000 patients per year in almost 150,000 visits. Over half of our patients are Latinx background. Almost 40% speak a language other than English. And those languages, at this point, it's over 50 languages. So we, without a doubt, serve an extremely diverse community. It is our privilege and our pleasure to do so. And we learn from our patients how best to provide care. Next slide.
All right. Alisa, that was just a wonderful overview of the organization. I'm still trying to wrap my head around 50 different languages, all the individuals speaking that in Lebanon and Lancaster. That's just fascinating. But I'm excited as we continue our dialogue today, as we talk about the merger during a global pandemic. I know I said that before. It's just still amazing about why that happened and some of the things that led up to that. You guys didn't know they merged March 1 of 2021. So a lot of the legwork and the discussions and getting up to that point truly happened in 2020 during that pandemic. So I can't wait to hear more about that. And then we're going to talk about moving on to the next normal, if there's any other way to say that. So what do things look like as you move forward post-merger, as well as the numerous challenges from employees through resources to providing that much needed care in the community at such a low or no cost. And then if we have time, we could talk just briefly about your COVID response. As a COVID testing center, as well as vaccination centers throughout these communities, I'm sure there were plenty of challenges there. So we do welcome your questions. Please do not forget to submit them. We have a few that have already come through as individuals have registered. But with that, I am going to turn it over to Gary to start some of this discussion about the merger.
All right, thanks, Janice. So a lot of ground to potentially cover here. And first thing that comes to mind, certainly, as we talk about going through a merger during a pandemic, you got two wonderful healthcare organizations with certainly some diversity within the two of them, and working in the healthcare world. And the biggest thing, many things come to my mind when it comes to a merger as a businessman. And so there's those business aspects, but there's so much culture, there's so much regarding employee retention. So let me just start with a broad question of, so what comes to mind regarding your biggest challenges that you faced with the merger?
So I think there were many challenges and many opportunities. It's hard to identify the biggest, but I did want to clarify, because I've heard you say a couple times, a merger during a global pandemic, and every time you say it, it kind of hits me like a rock across the head, because I'm like, oh, who would have thought to do that? But we actually planned to do the merger before the pandemic.
Sure.
So, and I think that's really important, because without a doubt, many businesses have had to transform as they react and continue to react and evolve from the pandemic. But we began conversating about the opportunity for a merger in November, December of 2018. And those conversations were really based out of looking forward and saying, how do we continue to provide high quality integrated healthcare to individuals who can't pay as our markets have more competition? So as you said, mergers and acquisitions are a business strategy. So that conversation happened with our board, our board chairs, and we began the process in November, December, January. And then of course, in February, we started to hear about this little thing called coronavirus, but it's somewhere in China. We don't have to worry about it. No big deal, right? And then March 13th happened to all of us. So our board, I really credit both boards in that they were progressive and visionary, and they said, we can't let this situation change our core priorities. Our core priorities are continue to serve the community. And we knew that those needs were going to evolve with the pandemic. So we could not stop the train that had already started, which was beginning the conversations and doing the due diligence process for the merger. So many, many challenges, but there was very strong strategy in our initial thinking about this decision.
One of the areas that comes to mind when it comes to a merger, of course, is the due diligence process. And you said it started, before things kind of got a little chaotic, that there was a very deliberate process. What things come to mind when it comes to the due diligence process? And when I say that from a business perspective is looking at the two organizations and how are we going to combine these culturally, economically, and to move forward.
Absolutely. So again, I give a lot of credit to both boards and their leadership. So we began by establishing a subcommittee that included 4 members of each board. So this 8-member subcommittee then contracted an outside consultant that was recommended to us from a local organization that had gone through a merger, and they were also recommended from a regional nonprofit support organization. So we had this consultant work with us, and they had gone through 100 mergers and acquisitions in their experience. So they actually gave us an outline that included legal, financial, operational, and organizational culture considerations. And we worked the process. We established a very clear process. We had weekly meetings, bi-weekly meetings, monthly meetings of the subcommittee. We took each area as it went. As you can imagine, finance was the largest set of the conversation, as it should be. Legal, of course, was a significant, but we never lost sight of the need to continue to talk about organizational culture, because I believe in Mark Sasser's quote that without a doubt, culture eats strategy for lunch. So regardless of the strategy that we had, if we weren't understanding how the cultures, both the strengths and the weaknesses of both organizational cultures, then the best laid plans would fall apart upon execution. So we began that due diligence process in February, and it took us through July. And our boards gave us a very clear 6-month go, no go. In 6 months, we would make a go, no go decision. So this conversation was not going to extend for years and years and years and then fall apart. We were going to work the due diligence process and make a decision in July, which of course the boards ended up deciding that moving forward with the merger was the right decision.
So much of that is employee retention, continuing to have the team stay together. And so communication wise, this is an interesting thing to me is, at what point was the merger brought out into the public that you were considering it? That, because some organizations try to keep it as confidential as possible to the very last second once the decision is made, because they don't want to distract people from doing what they're doing. They don't want there to be a lot of stress about their positions and, oh no, we're going to get merged and I'm going to lose my great position with the organization. So how do you do it from a communication standpoint to your people?
Yeah, so it was staged communication. And we're very fortunate to have solid communication staff in our organization that helped us develop the plan. So the decision was made in July. We spent August and September really planning our operational execution of it. We informed the leadership team in October, and we informed our staff the first week of November. We then gave it 2 weeks to settle. We informed our community partners first, our funders, our donors, community leaders, political leaders in both communities, and we staggered it that way. And we had individual group meetings. So we started with regions, and then we did focus areas where both the former CEO of Welsh Mountain, Jackie Concepcion, who is currently our VP of Community Impact, and myself together presented the vision of the merger and what more we could do for community. So when we started to talk to the community about it, we had already talked to all of our staff and key stakeholders. And we made the message to the community about the community. I think sometimes we make messages about us. Nobody cares. What they care is, how is this going to better serve their constituents, members of the community, their neighbors, their family, their friends. So that was a really important communication strategy. And we stayed on point. So we did not let ourselves get behind in terms of our planning. We stayed on top of our planning. And overall, the rollout of the communication went well. It was completed by the end of November. And the merger was executed in March. So there was a period of time in which the community knew about it, but we had not yet consummated the merger.
That's great. That's great, Alisa. I'm hearing a lot about how you stayed focused on your core priorities. You had really strong strategy in doing this, but I love how every step along the way, and you had a deliberate communication plan, and you got in front of how that benefits the community and benefits all of your stakeholders. So I know that the next slide you put here with the merger was about strength and unity. Can you talk to us a little bit about that?
So this strength and unity was the message that we were very clear of in the spring of 2020. And we needed to show that by coming together, by unifying these two organizations, we could do more for the community. We could stand stronger for community health. So that's the message that we put forth, and it's one we believe in. And it carried us through the merger, both implementation and now, the execution of it post. We're 6 months post merger, so we continue to talk about the strength that we have by having come together.
I love that, uniting our missions, roots, and services. So, but then you end with how it benefits the community. That's wonderful. I know you also gave us a little bit more information here about that strength and unity, and kind of built upon that patients and community, staff and organization, and donors and funders, which certainly are the largest groups of your stakeholders. So can you talk about the impact on some of these?
Well, without a doubt, it was important for us to be able to frame why this merger, answer the why question. So we had to look at who our constituents were, and we divided them into these three categories: our patients in the community, our staff in the organization, our donors and funders. So what we've seen 6 months post merger is that our patients and community have absolutely received more services. By coming together, we have been able to leverage our 100 years of collective history of serving community. We've been able to bring more resources. We've been able to get out in front of the challenges that have faced us, and we've been able to do more together than either organization could have done separately. In terms of the staff and the organization, we essentially took two sets of overhead and we brought them together. So we achieved immediate efficiency. There were systems that one organization had in place that we were able to just plug and play. And then where there was duplication, we chose the best one. So again, we achieved some immediate efficiencies there, and we have worked extensively to try to create one organization, one way of doing it, which is the union way, which is maybe a different way and a new way than the previous way we've done it. And then for our donors and funders, we've tried to stay very focused on showing the impact of this merger and doing it in ways that we can show both patients that are impacted, but also how we are helping our communities in Lancaster and Lebanon stay safe, which is what concerns many of our donors and funders during this time period in particular.
I love that statement there. As you said, you're finding the union way. So the best way to move forward as the two organizations have come together. So I'm curious, Alisa, what was the most surprising outcome of the merger? I think I caught her off guard with that one. I told her I was going to ask that, but as you were talking, I just really wanted to know.
You know, I think we knew how important organizational culture was going to be. I am a big fan of leadership development and organizational culture. It has surprised me how hard it actually has been. And I knew it was going to be hard. And it has been more challenging because I think sometimes as leaders, we all on this call, we know that we walk into situations and we think, okay, I need to explain the why. I need to get buy-in. I need to make sure to hear all voices, make sure to create an inclusive environment, strong leadership, you know, all these things that we know. And then we think, well, we have maybe better benefits. We've been able to increase pay. We have more consistency, more visibility in the community. We have better systems. Our staff is really going to like this. But we struggle with things like being bought into a culture that doesn't exist anymore. And for example, I'll give you a great example of how strong organizational culture is. One of our sites plants tulips every year, and they've been doing it for 25 years. Well, in the merger, guess what we forgot? Got to plant those tulips. And those staff were so upset about those tulips. So was it really about the tulips? No, it was about what they felt they were losing. So I think what has surprised me is no matter how hard we think it is when it comes to organizational culture, it's going to be harder. So the time, the heart, the investment, the communication, the proactive approach, no matter how much we think we need to do, we need to probably double that.
You know, organizations that are often talking about whether you're a nonprofit or for-profit branding and how you come out to the community. And so the word union, community care, that name, how did that come about?
Well, the good thing is we established strength and unity as our initial rationale. So strength and unity is what was established in March. And so when it came to names, we did secure the work of a wonderful local marketing expert, but unity was always going to be in it because that was the point. And so when we saw Union Community Care, it brought everything together. For those of you who are not aware, Welsh Mountain Health Centers, their logo had this beautiful heart in it. It was an orange heart. And Lancaster Health Center had this kind of window with these colors. So when they showed us this logo, if you can see it, there's a heart right in the middle. And my partner, Jackie Concepcion, she said, community has to be at the center of why we're doing what we're doing. So we had multiple conversations with the marketing expert. And so in those conversations, he took kind of the heart is the community. So the heart's in the logo, but the heart is the community is at the center of our name. So when we saw it, it was like a no-brainer. And we showed it to our board in small groups, and everyone felt that this is it, this is right. Our staff felt the same way. So they got it right. And we really like it.
I think, Alisa, when I look at that, your tulip story and the hearts in your logo, they come together nicely because it's all about the little things. It's all
Yes.
about the details and how that makes people feel and how that brings the community together.
Yes.
What a great reminder. Thank you.
How did employee retention go through the process? Now, one thing that as quickly has come to mind in our discussions is that you had two CEOs, Jackie and yourself, and it seemed like you were able to work very, very cooperatively, and I think that was an important foundation for keeping things kind of under control.
Mm-hmm.
Yeah.
Absolutely. And I know that's not always the case in mergers where both CEOs are able to stay in the organization. But it was in this case, and I'm very grateful for it. So Jackie and I, we were the initial folks who had the concept to do the merger. So it helped that we both knew this was the right thing to do. And as we started to plan it, we would meet for lunch or for dinner. And as the weeks went by, as we were planning, we knew that we were getting close to having to have the conversation of who wants to be the captain of the ship. And I wanted to avoid the conversation, and I'm sure she did too. And it came to the point where we couldn't avoid it any longer. And so we really talked about and we wrote down what we felt were the most critical skills that the CEO of Union needed to have. And then we just did a pro and cons list. And it was one of those where you kind of do a rock, paper, scissors, and you're hoping that the other person can beat you with what they have in their hand. But, you know, it was decided, and of course, it was up to the boards at the end of the day. But she really excels and loves community impact. So as our vice president of community impact, she has really taken the organization to the next level in that area. And it's my pleasure and privilege to have her as my partner.
It's great. I love to hear about that collaborative process. So, and I would believe that really helped the organization come together in a united way to move forward.
Absolutely.
So how did it ultimately trickle down to the employee level, and in terms of people staying course with you?
Yeah. So, you know, it was a very confounded time. So, for example, when we announced the merger to staff in November, that's after 4 months, for example, of our dental program being closed by order of the governor. So there were staff who were not coming back because they had moved on to different jobs. So we were a little confounded in terms of being able to tell you exactly how many people didn't stay merger related or non-merger related. Some of it was COVID related, childcare related, things like that. But it was really important for us to let staff know that direct service positions weren't going anywhere, that we needed them to stay with us. We have patients to serve. And we identified early on that where there was overlap, we were going to make decisions based on what was best for the organization. So, you know, we didn't give the impression that there were going to be no layoffs. I think at the end of the day, staff want to hear the truth, not what they want to hear. So we did have less than 5 individuals that we had to let go of because of merger related consolidation, but less than 5 out of an organization of 300, it's pretty good. So there wasn't the sense that there were broad layoffs. And we were also very clear that for us as Union, high performance equals desired behaviors plus desired results. So it was very clear to know whether you were in the right place. Desired behaviors plus desired results. So we also made sure from the very beginning, once we announced the merger, to start working on employee benefits packages so we can tell them how this was going to benefit them. We started working on new job descriptions and performance plans, and the merger was executed March 1st. We were able to do performance-based increases in April. So there was an immediate impact in the paycheck of our staff. And I think that was also one of the things that helped to create some buy-in and some trust that the merger ultimately was going to be a good thing for the community, but also a good thing for themselves and their families.
That's great. Let's move on to the next section here. All right.
Thanks, Gary. I think we're going to transition to to what in our discussions with Alisa, we call the next normal. So we're kind of hopefully coming out of the pandemic. You are 6 months into your merger. You've done a lot of things well to get you to this point. But we talked a lot about what do things look like moving forward. So at this time, we're going to focus on some of the topics here about lessons learned from financial preparedness. Could you handle this type of situation again as the merged entity that's stronger and really, serving and uniting the community? And we're definitely going to talk about the balance sheet, emergency funds, and the labor market. So we got some questions on that coming into this. So I've sort of teed this up with an outline here, but Alisa, I don't know, as a merged entity, you're like a $38 million organization, and your main expense is salaries and benefits. And you said you were able to make some adjustments to that fairly quickly post-merger. But that does run, upwards 65-70% of your expenses. So I know you've had to deal with some of those wage increases. You've had to deal with employee retention. So some of that seems a little bit insurmountable. So tell me about that as you came out of the merger and now you're moving forward.
And insurmountable is absolutely the right word. I think what we have experienced is something that no one thought would happen, and not just the pandemic, which pandemic flu we have been preparing for, but the duration of it and what it's done to completely change the relationship between employer and employee, costs for services and goods. So I think what really helped us, number one, was the timing that we continued with the merger, even though we were in the pandemic. So through the merger process, we were able to pay down organizational debt. So we are at $0 of organizational debt. That helps our bottom line at the end of the day. That we were going into it with some strong cash, and we were able to preserve that and not have to eat into that. We've used federal grants that have come. We've used them very strategically to cover new costs, not operating costs, because I've been very clear that these new dollars, it seems like they're flowing, but that flow is going to stop. And if we're reliant on that for cash flow or for operations, we are not going to be in a good position. So we always think of that as separate. We absolutely had to adjust salaries. That was not an option. So in an environment where you're asking doctors, dentists, nurse practitioners to come into work and potentially contract a disease that can kill them or a member of their family, you can no longer say it's for the good of the mission. So we had to increase salaries about 20%. So it is very, very significant. As we did that, we had to do that with our operational plan in mind for how we were going to cover those costs. And as a federally qualified health center, we have a couple levers that are a little bit different than the traditional fee-for-service model. So we had to use those very, very wisely. But I think we are, as healthcare, we are in a very precarious financial situation. And I would not describe it any other way. Both the changes, but also how these changes, how they may be sustained and for how long. And I'll just give you a quick example. So before the pandemic, a surgical mask, so one of these buddies, cost less than 40 cents. Today, they cost $1.30. And new OSHA guidelines say that you need a new one every day. So just that, it's a very small example, but multiply that by every good and service that we are using in healthcare, and the costs of providing care are just nowhere near what they were before the pandemic. And we don't have any idea when or if those costs will go down.
I think about that. You're federally funded. You have grants. A lot of them are fixed fee grants. You were fortunate to get some money through the pandemic, as you said, but you said previously you're based on sliding fee scales, and some people don't pay anything at all because they don't have the ability to pay, and no charge for services. It almost sounds like it's not all going to add up, but no debt certainly would help that. But here I am, the accountant, focusing on the numbers.
I know. And I can tell you, Janice, if I was smart enough to have decided to become an accountant, I would have much fewer gray hairs. But I decided that public health was my passion. and figuring out how people, regardless of their ability to pay, get access to high quality healthcare. So it is constantly about many levers, pulling many levers, and being as efficient as possible. But sometimes it doesn't always feel like it's going to add up. That's true.
Well, I'm certainly glad that public health is your passion. I'll stick to the accounting side. So as we're talking about some of the numbers, you talked about, Gary mentioned employee retention and how you keep them, and you mentioned some significant compensation increases. But I know a lot of organizations, ours included, like sometimes the paycheck just isn't enough. So what are some of the other things you're doing? You touched on culture, but tell me a little more about that.
Yeah. So I'd love to just quickly show the next slide, because I think it gives you an example of what we're doing. So the way we've thought about this is that what our employees want, and this is what their feedback is, of course, good pay. Everybody wants that. But they want this other thing that's so elusive, and it's called meaning. Meaning. Meaning has no dollar sign to it. And meaning has all the dollar signs to it, because it's about retention and recruitment and becoming an employer of choice. So as I'm thinking about meaning, how do we bring meaning? I think what we have decided to do in this organization is to lead heart first and lead completely with authenticity. So it was about July. I don't know if you all remember that in July, we were kind of feeling hopeful as a community. We had vaccinations, we had mass vaccination. If you wanted one, you could get one. Cases of COVID were down in our community. We were all probably going out and just feeling like things were going to be okay. And it was at that time that overall feeling of things were going to be okay was not in existence at all sites at Union Community Care. I had clinicians who were completely burnt out, emotionally, spiritually drained, and they weren't refilling their tank. So instead of just saying, hey guys, let's have a pizza party, or, free hot dogs in the lunchroom, that wasn't going to be enough. So we developed a year-long plan, which we call the Year of Healing. Every month, starting July, we have a focus, and you can see that on the left side of the slide, a focus. We provided staff with journals, and every month we do an exercise in our Year of Healing journal, and we do it together. We do it as small groups. We've brought in speakers. We've talked about how to heal from trauma. We've talked about varieties of ways of being able to refill our tanks. And we had to do that and give people some time to do that. So as you can imagine from the financial perspective, any time that folks are not seeing patients is overhead. And in this environment, how do you do that? But I think it was really important to say, if we are going to lead with authenticity and heart first, we cannot just talk about healing as something that's good for the community and good for our patients. We have to start with saying we do it as an organization. That's part of creating meaning, is by making our values and our actions aligned.
I think that's such a wonderful concept, that healing support, but turning that over to your employees as well. As we prepared for this webinar and had these discussions, I don't think I really got it until you said it here today. So thank you for that. I love that concept of a year of healing. We've all been through a lot in the last 18 months. And speaking for myself, I think most of us weren't prepared for that. And it is a good time to pause and reflect, and good for our organizations as well. So I know as we kind of move on from your year of healing, you're moving towards improving health equity. And you talked a lot about that, sparking equity. You also mentioned heart first and authenticity, which I think is wonderful. But there's so many things on this slide and in this model, I wanted to make sure that we touched on your diversity, equity, and inclusion initiatives. I think that's something that you really stand out with, particularly the community and the individuals you serve. So can you tell me a little bit about that?
Yeah, absolutely. And it really fits with your discussion theme, Janice, of the next normal. Mm-hmm. I don't think that as organizations and as leaders in this primarily, I will speak about the nonprofit world, but I think it applies to the for-profit world as well. Diversity, equity, and inclusion are no longer buzzwords. They must be organizational and operational imperatives. Because as we look to get the best talent come to our companies to work, the best talent, especially our younger talent, want to work in environments that don't just use the buzzwords of diversity, equity, and inclusion, but actually operate in a way that is clearly diverse in its institutions and its structures and the way it rewards and the way it retains and the way it recruits. So DEI, diversity, equity, inclusion, is our business advantage. And we're using it as that. I think we have to use it as that. So instead of just kind of starting and stopping, we decided to use a framework, which I provided here. If any of my partners on the line are interested, it's from the Institute for Healthcare Improvement. It just gives some foundations for how to approach this work, because it is a journey. I've been talking about it as a journey. It's not something that you should put in your operational plan as, okay, by December 2021, we're going to resolve racism. We're going to, resolve equity. It doesn't work that way, right? We're going to take
Wouldn't it be great if it did?
Wouldn't that be great? Yes. But we're going to take steps in that area. So that's one of the things that is part of our next normal, is to ensure that we are on the journey and making progress in this area, as I'm sure many of the folks on the line are doing as well.
That's great. Thanks so much, Alisa. And just a reminder, the time has gone by quickly. We're almost on in 50 minutes in here, but if anyone has any questions, we are going to try and leave a few minutes for questions at the end. So I think I'm going to move us forward as we continue to talk about this journey. I knew we wouldn't have much time, so maybe just a minute or two. If we want to talk about COVID response here. I don't know if there's anything you want to say, Gary, as we asked Alisa some questions.
I think that, moving forward, the focus on the community and, when you're talking about moving forward and the total health, I'm kind of into health, myself regarding it's not about medications. It's about, really dealing with the whole entire body, mind, spirit, et cetera. And so that obviously is incorporated in how you're serving your customers, your patients.
Absolutely.
It's and that's evolving, and on a day-to-day basis with new technology and new health discoveries.
Mm-hmm. Absolutely. Yes. Absolutely.
So
I think it'll be interesting that your vaccine equity. Any comments you'd like to share on that, Alisa?
Yes. So, even when it came to testing and contact tracing and now vaccines, we see our role through the equity lens. So we have wonderful partners, amazing hospital systems in our area that have taken on leadership role for things like mass testing, mass vaccination, which is beautiful. And we appreciate that. So what we do is we say, okay, who might be falling through the cracks? Where can we close the equity gap? And that's where we put our time and energy. So specific to vaccination, we have been focused on small events. We've been focused on taking vaccine to where the community is instead of asking them to come to us. So whether that's a local church, a local restaurant, a neighborhood center, that is how we've been doing some of our vaccination work. We've now done almost 15,000. The slide is already old. We've done almost 15,000 vaccines in our Lancaster and Lebanon community. And we're very excited to launch next month a door-to-door vaccine pilot. So we will be taking vaccine to communities that the data shows are under-vaccinated. And what's very important is, yes, we're taking vaccine, but most importantly, we're there to have a conversation. We want to be the trusted person that they can talk to ask those questions. So what we know is that folks who are not vaccinated, not everyone is refusing to be vaccinated. They're just hesitant. I'm hesitant about things I don't understand. I was hesitant about kale several years ago. I'm like, this is not a thing. This is not actually going to be something people eat, but I love kale now. So sometimes we just need a little bit of information. We need to try it. We need to have someone who's tried it tell us, hey, I did it. I'm okay. You might be okay too. So we're taking folks who speak the language, who are from the community, and we're actually in our door-to-door, we call it neighbor to neighbor. we are identifying ourselves as their neighbors because we live in the community as well, and saying, I'm here to talk to you about the vaccine. And for folks that are interested, we have it at the ready and we can provide it right then and there. So we're excited about that. And that's really part of our mission. It's the equity piece.
That's great. Thanks so much, Alisa. I'm going to move us on to our next slide because this is such a powerful slide moving forward. So, Alisa, I guess briefly as we come to the end here, what's next? We talked about the next normal. We talked about the merger. There's so much that's happening. You talked about one piece that's next is your door-to-door vaccine program, but meeting people where they are. So is there anything else you can share with us about what's next?
Yeah. So, lots of things are next for us. In particular, we are looking at how we close the gap in the mental health needs that have become so significant in our community post-pandemic. And of course, we know about the opioid crisis, and that's very serious, and we have a lot of work to do there. But we also have folks that are really suffering from severe and crippling depression and anxiety. So looking at how we as an organization build our services in that area is something that's really important to us. So that's from the mission side. From the operation and the financial side, the question I have for myself is, how do we do good and do well from a bottom line perspective? How do we make sure that we make good investments with one-time funding, but that we also don't get reliant on it for our operations? So that's a constant balance, and something that we'll continue to work on because it's essential for these services. We have to make sure that they're sustainable. So those are the things that are in front of us. Those are the challenges that we face.
Yeah, certainly no lack of challenges, but I think we can all relate to that these days. So any one last word of advice to share or impart on anyone through your experiences?
Well, I have a solid personal rule, which is I don't give advice. But what I can say is that this community, Lancaster, Lebanon, Central Pennsylvania, is such a wonderful community from a business perspective. I know the nonprofit side of it. So lean in, talk to, of course, we have you all at McKonly, but lean into partners, ask questions, learn from others. It's a wonderfully inclusive environment, and I've found other organizations that are similar to us to be very open with suggestions and ideas. So not advice, just something to consider.
All right. Well, Alisa, I have greatly enjoyed the discussion this afternoon, the discussion about your merger and the next normal and your journey and what's to come for Union Community Care and the community in the future. I love how you're seeking out those who are falling through the cracks. And that you're leading with heart first and authenticity. So I think we can all learn from those words. And I'm confident that you are building vibrant and healthy communities in Lebanon and Lancaster. So thank you so much.
Thank you.
If there's any questions, I am seeing some comments. Thank you. I think some of you enjoyed it here today coming through the chat. So we enjoyed speaking to you as well. And I think I'm going to turn it over to Gary to wrap us up.
All right. Once again, thanks, Alisa. Very dynamic discussion. And for somebody who is a non-accountant, I think you know the numbers pretty well. I'll say that absolutely. And it's so important for mission-driven organizations that they've got to each step along the way to keep in mind the fiscal bottom line, because if you're not healthy fiscally, you can't do what you need to do in a long-term basis. So thanks so much for the dynamic discussion here today. And for those that are on the call here at the webinar, please don't hesitate to reach out to Janice, myself, Alisa. We're here to answer questions. And I don't know, is there anything else, Janice?
I don't think so. I just advanced to the slide with all our contact information, but I just can't thank Alisa enough for helping us wrap up this series. Friday afternoon on a beautiful fall day is a very tough time slot. So we hope you all enjoyed it. I certainly did. And we thank you for this in-depth discussion on healthcare in our communities. All right.
All right.
Everyone have a wonderful weekend. See you later.
Thanks.